Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday, the 22nd of September 2021. The numbers today are that we've got 40 COVID positive patients in the hospital. That's within 14 days of their first positive diagnosis. And of those, 33 are on the general wards, 5 are in critical care, and 2 patients are at Clifton. This time last week I reported 54, so that number's moved in the right direction really. 23 additional patients are in hospital because of COVID who are more than 14 days. So the number is still not insignificant. Nationally, it looks as if hospital admissions for COVID are falling a little bit. So I hope we're on a trend, but I think, frankly, it's too early to say. So we'll watch that. The community numbers have come down a little bit since last week as well. Last week, Blackpool was in the high 500s. Today, for per 100,000, the number is 465. For Fylde, it's 403, and for Wyre, it's 410. So all of those have shown a bit of a reduction. So we'll hope that that trend continues in that direction. We've announced and uploaded 8 further deaths within 28 days of a first positive COVID test through the system. So condolences to the loved ones and families of those involved. You know, frankly, that is still an ongoing situation for us all. Important that we are thoughtful about that. Linked to that is perhaps our visiting policy. So I've mentioned before that we're trying to ease our visiting policies as much as we can. So it's not like it would have been 2 years ago, but we are able to allow visitors to all areas of the hospital except for a couple of wards where we have a high density of COVID positivity. That's actually wards 2 and 5 and some parts of critical care. But all the kind of rules and regs about visiting are on our website, and because they change a little bit and because they're different for different groups of people, I'd urge you to have a look at the website, please, if you're planning to come and visit somebody on site. And if you do come on site, we are still following NHS infection prevention and control rules and regulations. So we will insist on a face mask being worn, and we've got masks and gel at the door, of course. We are trying to maintain a 2-metre distancing, which is of course very difficult to do in all sorts of spaces, but we're still conscious about spacing, and we'll be asking everybody, of course, to gel and to wash hands on a regular basis. Linked to that, just advice about at home, if you've got gatherings and so forth, quite a bit of evidence about airflow being important. So opening windows, making sure there's ventilation in spaces where people are meeting is shown to be an important thing to do. Now, in terms of vaccinations, the update really is that there is now a vaccination program, a booster program for COVID for everybody over the age of 50, and that has started to operate. So many people will be getting messages through email, telephone, through apps to update about that. We're now in a position to start to give a booster to all NHS frontline staff and then all NHS staff, so that's actively happening. And that's a booster, and important to say it's okay to have the COVID booster at the same time as a flu jab. So if you're booking in for a flu jab, with a bit of luck you'll be able to get a COVID booster at the same time. When the first round was being done, there was a gap between the two, but there doesn't need to be now. Now, for patients who have particular conditions, who are thought to have a reduced immune system, they are being called for a third jab. That's actually part of the primary course of immunisation rather than a booster. But that list is in the system, and GP surgeries and ourselves are reaching out to the patients on that list to arrange the third jab. The jab there. So that's really where we're up to with COVID. as I've said before, we know all across the country, but it seems to be particularly here in Blackpool, emergency departments are extraordinarily busy, and we need to keep asking people to be very thoughtful before coming to emergency departments, and to think about using the wider systems such as NHS 111 to get advice. And actually, there's a very good piece on the internet. If you were to go to nhs.uk and put in when to go to A&E, or indeed put all of that in a search engine, NHS UK, when to go to A&E, there's a very good list and very good advice flow diagrams to follow, which I think are very helpful. So I guess if in doubt, there's an easy opportunity to do a little bit of research and find the best way through the system. So thank you so much as ever. Clearly, COVID is still an issue, and we're nudging towards winter, and we need to be thoughtful about other respiratory viruses such as influenza beginning to develop. So the flu jab program is really important. But the same advice that goes to help us prevent COVID also helps reduce the incidence of these other conditions. So the hands, face, space advice is good advice for many things, not just COVID. Thank you.